So hopefully this is going to be informative in lots of different ways that maybe you can share with family and friends as well. I don't necessarily enjoy speaking, but I enjoy this topic, and so I've tried to make this interesting too. So I hope it is to you. First off, I like humor. I think humor is what makes work happy, and there's lots of chances to have humor in dentistry. So I hope you enjoy this. This is just a short little clip. Okay, Tim Conway is really, really funny, and that skit, yeah, look it up when you get home. It's really funny. YouTube, Tim Conway dentist. It's quite a riot. Anyway, I was asked to talk a little bit on dental wellness and oral health wellness. And so the first question I want to ask you, is it really that important? Are teeth really that important? And so, by the way, I want this to be interactive. So I don't just like to lecture, so I'm going to actually ask you to participate if you can. If you don't know the answers, that's fine, but if I call on you and you don't know, yes, it is. You're right. The answer is yes. And why is that? Why is it so important to have good oral health? And the answer to that question is it is a window to your overall health. Many manifestations in our bodies also first show themselves in your mouth. And so, interestingly enough, many systemic conditions are first diagnosed because of things that are happening in your mouth. So, the first thing I want to talk about is, this is my wife. Come on up here, Cherie. We're being recorded, so I just want to put my arm around you for a second. This is my wife. Her name is Cherie, and hello. She is behind the scenes in everything in my life, so she sure helps me with everything. So proper nutrition. The first thing I want to talk about is the relationship that good oral health has with proper nutrition. And the first thing I want to talk about is healthy teeth aids in chewing. Now, is that a big deal? Everyone's shaking your head, yes. It sure is. When food is chewed properly, nutrients can be absorbed better. If any of you know anyone that are missing teeth or might have dentures, it's very difficult to chew. And subsequently, it's very difficult to digest their food. A lot of foods they no longer can eat. Some of you might know that or have had an opportunity to experience that if you have a toothache or any problems like that. Also, saliva contains digestive enzymes. So the longer you chew, the more time these enzymes have to start breaking down your food, making digestion easier on your stomach and your intestines. Saliva also helps to lubricate your food so it's easier on your esophagus. All right, continuing that, the chewing process. Now this is right before lunch, so wonderful, right? Pre-digests your food into small pieces and partially liquefies it, making it easier to digest. Again, the whole purpose of us to eat is to bring nutrients into our bodies and allow us to have energy and strength. Your proper nutrition is very important. Let's see, making it easier. Digestion is actually a very demanding task for your body, requiring a great deal of energy. That's why after we eat, we're tired, because all of our blood goes to our gut and is working on getting that going and getting the nutrition there, especially if forced to digest improperly chewed food. Chewing properly allows your stomach to work more efficiently and break down your food faster. Chewing is also good for your teeth, believe it or not. That action of chewing stimulates the bone and stimulates your gums and helps keep things healthy. If you've noticed anyone or have seen anyone that has a missing tooth, their bone starts to go away. And that's because they don't have anything there stimulating in the bone. So chewing is good for your teeth. Okay, this is the other thing I'd like to talk about quickly. Good oral health environment helps us with our self-esteem, helps us with the way we feel about ourselves, which is very, very important. A white smile doesn't just indicate healthy teeth and gums. Your dental health also plays a significant role in how confident you feel. Think about it. If you're self-conscious about your smile, you're not going to feel very good about interacting with others. A bright white smile helps you show the world you are confident and care about your oral health. Some of you might know who Dr. Oz is. He says an attractive smile can bring self-confidence and a greater quality of life. So, yes. Absolutely. And that's a great thing. It's very individualized and very personal. Some people want milk white, the whitest white they can have. Some people, they don't want that, and they're happy with their smile. But a smile is individual. It's not something that is, okay, your smile is good and your smile is not. No, it's an individual decision. And some people might feel like their smile is perfect, while the other people might think, no, I need it as wide as can be. So, yeah.
So I think, a lot of people bleach their teeth, is that really that healthy?
Bleaching your teeth or whitening your teeth, if done according to instructions. So there's the Crest White strips you can buy over the counter. There's going to your dentist and getting the gels and doing it over a period of time. If followed directions properly, it is very healthy and very safe. Some people don't follow the directions and overdo it, which can cause a lot of sensitivity and cause some damage to the gums. So as in anything, you've got to follow the directions on it. Does it cause the enamel? Some people think, well, bleaching or whitening teeth can cause the enamel to be damaged. If you follow the directions, it's very safe. It can cause sensitivity, though. Did I answer your question? Okay, so we've talked about those things. Now let's kind of broaden it a little bit. I mentioned earlier at the beginning that things that happen in the mouth can indicate other systemic problems. So things that might be linked to oral health, endocarditis. It's an infection of the inner lining of the heart. We've found that is linked to the bacteria in your mouth. Also, cardiovascular disease. Again, another heart thing. Some research suggests that heart disease, clogged arteries, and stroke might be linked to the inflammation and infections that oral bacteria can cause. Now, this one's an interesting one, pregnancy and birth. Periodontitis, which is the infection in the bone around the teeth, has been linked to premature birth and low birth weight. I thought that was very interesting. Here's the next one, diabetes. Diabetes reduces the body's resistance to infection, putting the gums at risk. Gum disease appears to be more frequent and severe among people who have diabetes. Research also shows that people who have gum disease have a harder time controlling their blood sugar levels, and regular periodontal care can improve diabetes control. I think the statistic out there is that there's upwards of 25% of Americans who undiagnosed pre-diabetic. It's a pretty fascinating statistic, really. But diabetes is something that we all should be aware of and should be aware of the consequences of it. Osteoporosis. Anyone know what that is? Brittle bones is one of the words. Low calcium or low minerals in the bones. Elderly women are most prone to it. Some elderly men. But osteoporosis, cause of lack of essential minerals in bones, as she said, it's weak and brittle bones, may be linked to periodontal bone loss and tooth loss. But interestingly enough, some of the drugs that have been introduced to us that are used to treat osteoporosis cause mouth problems. And so you need to be aware of that. They've found that some of these drugs actually can cause your jaw bones to necrose and die. And so this wasn't known for a while, and now it's coming into as mainstream that you've got to be careful for if you're being treated for osteoporosis. Okay, let's focus on the mouth now a little bit. What causes teeth and gums to be sick? Now this is where I want interaction. What do you think? Not brushing, okay. The root cause, though, what's the root cause? That's one of the symptoms of them being sick, but what's the root cause? I heard it.
Bacteria.
Bacteria. Plaque is also part of it, but it's mainly bacteria. Bacteria is the reason why. Cavities form when there's breakdown in the outer calcified enamel of the tooth by bacteria commonly found in the human mouth. Our mouth is teeming with bacteria. There's nothing we really can do, nor do we want to get rid of all the bacteria in our mouth. It's just there. Bacteria can be on any tooth surface, including the tongue, cheeks, lips, anywhere. Bacteria is at any age. Now, you've heard that little babies, they get introduced to bacteria through spoons and through pacifiers and through sucking on toys, and even without teeth, there's bacteria in their mouth. But it can affect gum as well as causing gingivitis and eventually periodontitis. So, in order for us to have a healthy mouth, we need to control the bacteria in the mouth. That's the key. Now, there's a few things that God has given us, that our Creator has given us, that helps us to do that. And the main thing is saliva. Believe it or not, saliva is one of our biggest defenses against bacteria and tooth problems that we have. Another is the food we eat. That makes sense, right? The next is pH. Do you know what pH is? Yes. Acidity and neutrality and basicness. So the pH in them is also key. Medications play a huge role now. Everyone that's on a medication, that medication has a side effect. Regardless of whether you think it does or not, it has a side effect. And then, of course, brushing and flossing. So brushing and flossing is typically what we say is going to do the job. Well, all these other things play a part as well. Okay, that always freaks me out when it comes up like that. Saliva, let's talk about saliva. Saliva is made mostly of water, and it helps to break down food for your body. But saliva also does a lot of things for your mouth as a whole. It keeps your mouth moist and comfortable. When you're up talking in front of people, you notice it dries out. I'm experiencing that right now. Helps you chew, taste, and swallow. All of those things, your saliva, if you've ever tried to eat a soda cracker, I used to do this when I was a kid. My brothers and I would see how many soda crackers we could eat at a time without drinking water. It would dry our mouths out, and pretty soon we couldn't do it. You can't really swallow your food without saliva. Helps fight germs in your mouth and prevents bad breath. So saliva has antibiotics, natural antibiotics in it, and it helps to break down and kill bacteria. Has proteins and minerals that protect tooth enamel and prevent tooth decay and gum disease. So, yes?
Is age-related, is less saliva age-related, or is it more caused by medications, like you said, or the dry air in the winter? Or, I mean, my mouth seems to be more dry in the winter time. I don't know, but I thought, well, maybe it could be age-related.
Unfortunately, age does play a factor in it. Age, as we all know, things that used to work really well in our bodies, we can run when we're young, not so much when we're older. We have 6 saliva glands in our mouth that all produce saliva. Well, over time, those saliva glands can shrink and atrophy a little bit. And they don't respond quite the way they used to when we were younger. So it can be age-related. Most of the time, it's more environment-related. So, and what I mean by that is, if it's really, really dry outside, you're probably dehydrated anyway, and the amount of water in your system is lessened, and so therefore saliva's production is less. So that could be the case there. Keith, we doing good?
So far, so good.
Okay, good. Any other questions about saliva? The food you eat. The food you eat also plays a very important role. Now, all of us, I'm sure, eat very healthy, right? All the foods that we eat are top-notch. So we're going to talk about bad guys for your teeth, and then we're going to talk about the good guys for your teeth. All right? And I want you to tell me if you can see the correlation. The bad guys, sugary candy and sweets. Why are sugary candy and sweets such a bad thing? They're so good. Any other thoughts? I'm sorry? Yeah, what does sugar do? Sugar feeds the bacteria that are in your mouth. So we're giving them an opportunity to feast on things. Now, sugary or sticky candies also sit on your teeth a lot longer, and it's harder for the saliva to break it down. It's harder for us to brush it off. Candies like Starbursts or Milk Duds or Taffies, those kind of candies sit on teeth and just they're a feast for the bacteria. Snacks like cookies, cakes, and other desserts contains high amount of sugar, which can cause tooth decay. If you eat foods like these, limit them when you eat them instead of snacking on them through the day. And that's one of the things that it's maybe difficult to really do, or maybe you're not even aware. If you've got a bag of cookies or a bag of chips and you're snacking on them all day, you're introducing these kind of foods into your mouth all day long. Whereas if you were to eat the whole bag at once and be done.
So you're saying I should purge all of my goods
Yeah,
at once?
yeah, just all at once. Yeah, brush your teeth and you're good, right? Starchy or refined carbohydrates. Foods such as chips, breads, pasta, or crackers can be harmful to the teeth as candy. Starch is made from white flour or simple carbohydrates and can linger in your mouth and then break down into simple sugars. Bacteria feed on these sugars and produce acid, which causes tooth decay. And that's really the whole system is bacteria feeds on the simple sugars that are in our mouth. Their byproduct is acid. Acid changes the pH of our mouth, changes the pH of the environment, which harms the minerals in our teeth and which breaks it down and causes cavities. In a nutshell, that is how a cavity is formed. And so if we can control these things, we can prevent them a little bit more. A few more problems. Carbonated soft drinks. Sorry. You knew I was going to talk about that, though, right? Regular soda contains a high amount of sugar. Both regular and diet sodas also contain phosphorus and carbonation, which wear away the enamel on your teeth, causing them to become stained and brown. Many energy drinks and bottled iced teas and lemonades also contain high amounts of sugar and acidity that wear away tooth enamel. If you regularly consume soda, you should use a straw to keep it from having too much contact with your teeth. I did a presentation at ACYI a couple of years ago about the effects drinks have on kids. And I did some research to find out which drinks had the highest amount of sugar and acidity versus which drinks had the lowest. And obviously water was my control, water was the lowest. And what do you think the highest, most damaging drinks were? Okay, these are all very high on the list. Lemonades, orange juices, things that you feel like should be healthy, really weren't. But the number one were the energy drinks. Energy drinks they've been introduced as something that gives us energy, and they're loaded with caffeine, but they're loaded with sugar. And they're really affecting our kids in ways that we probably haven't even begun to understand yet. But energy drinks were on the top. After that, the lemony soda drinks like Sprite and Sierra Mist, those that are very acidic, that change the pH, again, of our mouth. Then we look at the colas, the Mountain Dews, and then we go down from there. So drinks, really we have to be aware of what is in our beverages that we're drinking. They might taste really, really good, but if we're sipping on a soda, I like that you have a water bottle. That's good. That was on purpose, right? Yeah. If you're sipping on soda all day long, even if it's a diet soda, again, you're changing the environment of your mouth and creating an environment where tooth decay can thrive. Fruit juice is another thing that's bad for us. Unless it's straight from the fruit, squeezed naturally, all fruit juices have additives and additions to them that cause them to be a little more harmful to us. Now, I put this one in because it's not uncommon. Some people love the taste of lemons or real citrusy fruits, and so they eat a lot of oranges, or they eat a lot of lemons, or they suck on lemons, thinking they're fruit, they're okay. Well, that actually isn't okay because it changes, again, the pH of the mouth. It changes the environment where the mouth of the mouth, which causes bacteria to thrive. So you got to be careful about that. Excuse me? Yes. So I have lots of patients that say, I'm not giving up my soda, or I'm not giving up my drinks, or this and that. And that's fine. It's not my job to police that. But what I say to them is, look, if you're going to do that, either have a glass of water afterwards to rinse your mouth out, to rinse your teeth off from that acidity that's in there. That's not hard to do. We can always have a glass of water afterwards, and that does help. Yeah, for sure.
Pam had a question that
Yeah.
I do a lot. Putting lemon in just their water, or just drinking lemon, is that?
That's not bad. My wife does that too. A little bit of lemon in the water does not going to change the water pH enough to affect it. It gives it a little taste, which sometimes is nice. Now, if you're sucking on the lemon, it's a different story. So don't suck on the lemon. Okay, good guys for your teeth. Now, remember all the bad guys? Remember that big long list? Now let's talk about the good guys. Foods with fiber stimulate saliva flow, which is a natural defense against cavities. Not only does saliva wash away food particles and clean your mouth, about 20 minutes after you eat something, saliva begins to neutralize the acids attacking your teeth. Opt for crisp fruits and vegetables like apples, carrots, and celery. We all know that. We've been told that since we were small. Fruits and vegetables. Here's another one. Cheese, milk, plain yogurt, and other dairy products. These have calcium in them and phosphates, vitamin D. In the cheese and milk and other dairy products are important minerals for the health of your teeth. Your teeth are made mostly of calcium, and without enough in your diet, you risk developing tooth decay and other problems. Again, we want minerals in our bodies. It's very important. Here's one that I put in because I see this really does help. Sugarless chewing gum. Sugarless chewing gum, and it has to be sugarless. If it's anything but sugarless, you're introducing a lot of sugar and problems into your teeth. But sugarless chewing gum has been proven to reduce the amount of bacteria in your mouth by helping to cleanse your teeth. Chewing gum contains sugar. Chewing gum containing sugar may actually increase your chances of developing a cavity. Sugarless gum containing xylitol, which has been shown to have decay preventive qualities, may even have an added benefit. Research indicates that xylitol most likely inhibits the growth of Streptococcus mutans, the oral bacteria that causes cavities. So what are some of the brand names of sugarless gum? Orbit, Dentine, Trident. Yeah, all of these are really good. And actually, it's really the only gum we should be buying for us and for our children. If our kids are buying Big League, the Big League bubble gum and Bubblicious and that kind of thing, they're just introducing straight sugar to their teeth. So not a good idea. Now, water with fluoride. Fluoridated drinking water or any product you make with fluoridated water helps your teeth. This includes powdered juices and dehydrated soups. I believe here in Brigham we have fluoridated water, and it's an added benefit. It is a good thing. Now, does anyone have contrary opinion to the fluoride in the water? I'd be interested to know.
Now I have a question.
Yeah.
Is there a point, an age when it's more effective than as you get older? I've heard that it doesn't matter so much when your teeth, are forming, or is it any age?
That's a great question. It's most effective when the kids are developing their teeth, so young, moving into age 15 or 16. That's when the teeth are all developing or have developed, are the most susceptible to cavities. Fluoride in the water ingested helps that way. But it also helps to replace the minerals lost in saliva and in your teeth if you ingest it as an adult. Remember, the saliva helps to bathe the teeth. The saliva has minerals in them. And as the saliva bathes the teeth, it helps to replace those minerals actually on the teeth that are. That's why we, as adults, we even put fluoride varnish on your teeth. I don't know if any of your dentists do that, but at our office, on the adults, we put a fluoride varnish on, and that helps to replenish the fluoride. How long does that stay on? The varnish stays on about 4 hours, the sticky part of it, which is enough time for the fluoride to actually get into the matrix of the enamel.
Can you have too much fluoride?
Yes, you can. There is a condition called fluorosis, and when fluoride was first introduced into water, we were still kind of unsure of the amounts it should be, and so many cities were doing these studies. And while I was in dental school, I did a study on fluorosis and the effects or the optimal dosages, and we found that 0.7 parts per million to 1.2 parts per million was really the amount in the water that you should have, that a municipality should have. Anything above that can cause brown spots on the teeth, which is called fluorosis. Below that, it's not very effective, and so there's a sweet spot there. Now, the trick is, you put it in the city water. Well, most people are buying what? Water bottles. And so if you're drinking just from water bottles, we're not sure where the water's coming from. Is that water fluoridated? Are you getting the benefit? And so there's some controversy with that. And also, with that said, some people don't want to have fluoride in their water. Period. They want the choice of fluoride or not to have fluoride, and they feel like fluoridated water is taking that choice away. Well, I believe the benefit is much greater to have fluoride in the water than to not, for greater people. I've seen communities without fluoride in their water, and the amount of cavities in the kids, and it mainly affects the children, is quite high. Was there a question over here? Does a filter take out the fluoride? It depends on the filter. Some do, some don't. It's the higher end filters would. The ones that you just hook to your sink, the faucet, typically don't. But it will say on the packaging the things that it filters out fluoride or not. So depends. That's true. Refrigerators do too. Yeah. Okay, pH. The mouth likes to be around pH of 7. That's neutral. That's what saliva is. So anything we eat that's acidic will drop that pH down. Does anyone know the pH of, say, Sprite? Yes, sir.
Okay, orange juice is 3.
Okay, orange juice is 3. Sprite?
There's a strong acid. I mean,
It is.
When you go to your colas and so forth, I was a hazmat guy, so we played with this kind of stuff. But yeah, it's amazing some of the stuff that we eat. Orange juice and your cola drinks will take them clear down to a 3.
3, 2.8, 2.6. Battery acid is a 1.4, 1.2. If you ever want to, I did another presentation down at the schools where I took a hard-boiled egg and I put it in a cup of Coca-Cola, and it dissolves the shell within 12 hours. I mean, it's acidic. So we got to be careful. Medications is another big one. A lot of people that have medications that take them for cardiovascular disease or high blood pressure or diabetes or depression, all of these kind of medications alter your systems. Many of these medications, even including antihistamines and decongestants, cause you to have less saliva. They reduce the amount of saliva in your mouth. And you might have a parent or a friend that says, my mouth is always dry, or they're always carrying around a big bottle of water that they have to sip on. That's because the medications they're taking are reducing the amount of saliva. When that happens, it changes the pH of the mouth again, it alters the immune system, And I see cavities in elderly men and women all the time that are on these medications. And sometimes there's nothing we can do about it. They have heart disease or they have depression, and they have to take these medications. And so now we have to figure out how to mitigate the problems, how to help them. Now, of course, brushing and flossing is also, I mean, that's really what we mostly think about when it's oral health, right? Brushing and flossing. I thought about doing this, but in the interest of time, I won't. But brushing for 2 minutes. How many of you brush for 2 minutes every day? Our hazmat guy does.
Usually because I put my toothbrush in my mouth and walk around doing other things, get ready for the day, and after about 10 minutes,
Very good. Okay, so some of these new Oral-B or Sonicare toothbrushes have timers on them, and you'll be amazed at how long 2 minutes actually is. It is forever. And I was thinking about having my wife come up here and sing a song for 2 minutes, but I won't. Just to demonstrate how long 2 minutes is, but 2 minutes is a long time. It really should be 30 seconds each quadrant of your mouth. That's what studies have shown the amount of time it takes to really clean it. Now, twice a day, that should never, ever be missed, no matter what. Twice a day, morning and night. That's the minimum. I like to brag about this. There's not many things I can brag about myself, but I'm pretty good at brushing, and I haven't had a cavity since I was 10. And so I think it works. I really do. Brushing twice a day works. I have good genetics. Yeah, that's true too. Okay, soft toothbrush. Some people think, well, I'm going to brush with a harder toothbrush. It's going to get it cleaner. And that's not true. What a hard toothbrush does is it actually destroys the gums around the teeth, and it harms the enamel. So a medium and a hard toothbrush should never be used for any circumstance. I can't think of, maybe to clean the terminals of your battery on your car, or the grout in your tile. Maybe that's a good thing for a hard toothbrush, but not in your mouth. Using a fluoride toothpaste, I believe, is the best way. There's all sorts of fluoride toothpastes, all different brands. All of them work. It just depends on your preference. And controlling the pressure that you put on. I like to say, when you brush your teeth, if you're holding it with your fist and you're really pressing hard so that your bristles splay out, you're brushing too hard. It's not about the pressure, it's about the technique. And so if you're having to replace your toothbrush every month or 6 weeks, you're putting too much pressure on. Flossing. How many of you floss every day? I don't either. But flossing helps to remove the material between your teeth. At the schools, I do this presentation where I put on a rubber glove and I smear peanut butter all over my hand on that rubber glove, on that latex glove. And then I have a young man or a young woman come up and I give them a big toothbrush and I close my fingers like this and I say, brush it. And I put my hand on a tray and they brush. And I say, you want to get all of it out. Get it all off. And they get it all off. And then I flip my hand over and they get it all off. And I say, okay, did you get everything? And they say, yeah. And then I spread my fingers apart and there's peanut butter everywhere. And it's a visual for them to see that you really can't get everything out of your teeth with just your brush, unless you have spaces between every tooth, which most of us don't. And so flossing helps to remove those particles of tooth behind, or between our teeth. So brushing and flossing.
Is there much benefit to mouthwashes? I haven't seen that addressed.
That's a great idea. That's a great question. Mouthwashes are excellent. Listerines, there's the Pro Health from Crest. Yes, they help to reduce bacteria. That's the main thing that mouthwashes do, is reduce bacteria in your mouth. It does not replace brushing or flossing. If some of them contain alcohol, which have a lower pH, which may not be the best thing for you. Some of them kill all the bacteria in your mouth, which isn't a good thing either, because we need to have healthy bacteria in our mouth. But you can't go wrong if you brush and use mouth rinse and floss. You will have a very healthy mouth. So, in conclusion, yes?
Yeah, so after you rinse with the rinse, then should you rinse with water or kind of walk away?
It depends on the mouth rinse that you use.
I'll look on the bottle.
Sometimes, like Listerine is it stings quite a bit. And so I like to rinse after that with water. There's another, the Pro Health rinse from Crest. Doesn't sting as much. And so it's not really that necessary. There's a toothpaste by Colgate called Colgate Total that has a substance in it that actually kills bacteria. It sticks on your teeth and kills bacteria, they say, for 12 hours. And so there's all these things that you can use to help. But again, it's controlling bacteria is the key. So my final thoughts. Those who don't pay attention to their oral well-being early on in life will spend the majority of their adult years wishing they had. I see this every day where people tell me, gosh, I wish I would have taken care of my teeth better when I was younger. And so if I could give any type of impact to you at all, I would say start early. Start with your kids, your grandkids, your friends. It is important. And then finally, only brush and floss the teeth you want to keep. So, thanks a lot. It's been fun. You've been a great audience. Any questions? Okay. So I've brought toothbrushes for anyone. So, so you can come up and grab one for you and a spouse or a kid, or I brought 20. How many are there here?